Okay, the subject I chose for my presentation is somatic symptom disorders and dissociative disorders. We're going to go over the presentation, pathophysiology, and nursing considerations. Okay, so somatic symptom disorders are ones in which physical symptoms are present, including feelings and behaviors, pain, causing significant distress and dysfunction. They may or may not be explained by a physical cause. Some of the conditions classified under somatic symptom disorders would include conversion disorder, body dysmorphic disorder, pain disorders, hypochondriasis, factitious disorder, illness anxiety disorder, and somatoform disorders not otherwise specified. Symptoms associated with somatic disorders include pain, shortness of breath, or fatigue or weakness. They're unrelated to medical causes. They can be moderate, severe, or mild, and include much of worry about those symptoms. People that have a greater risk for somatic symptom disorders are those that have a diagnosis of anxiety or depression or experience stressful life events. The exact cause of somatic symptom disorder isn't one that is clear, but some factors, including genetic, biological, and family influences, may be applicable. Somatic symptom disorders are treated with a combination of psychotherapy and medications, primarily cognitive behavioral therapy aimed at changing behavior of the patient to redirect their focus. Medications include antidepressants, would have the benefit of helping with both the depressive symptoms, anxiety, and pain. Dissociative disorders are characterized by an involuntary escape from reality, disconnection between thoughts, identity, and memory. The symptoms develop typically as a result of a traumatic event. Almost half of adults in the United States experience at least one event. Conditions classified under dissociative disorders include dissociative amnesia, dissociative identity disorder, and depersonalization and derealization disorders, all of which involve some degree of separation from the mind with the physical world. Some of the things you'll see with people who have dissociative disorders are a sense of detachment, memory loss, a surreal sort of perception of the people around them, and difficulty with identity and coping. Dissociative disorders are most commonly developed as a way of dealing with trauma, including physical, sexual, or emotional abuse. PTSD related to natural disasters and combat can also be things that trigger dissociative disorders. Treatment for dissociative disorders involves psychotherapy and medications. Psychotherapy is aimed at integration of personalities or resolving dissociative feelings. Medication treating the symptoms of dissociative disorder or the facts contributing to it. Nursing diagnosis and outcome priorities for dissociative and somatic symptom disorders are aimed at coping knowledge and perception with goals of having the patient being able to identify contributing behaviors and precipitating symptoms to dissociative and somatic symptoms. Nursing interventions are aimed at identification, encouragement, and not focusing on the disability or dissociative states, in addition to supporting the patient through the therapy processes. Evaluating the outcomes involves questioning whether or not the patient has achieved recognizing associated symptoms and being able to discuss personalities or dissociative states that the patient may be reaching and identify precipitating factors.